Anatomy of injury apply test. The meniscus is a C-shaped cartilage that serves as a cushion between the proximal tibia and the distal femur, which is made up of the knee joint. The average width is 10 mm to 12 mm, and the average thickness is 4 mm to 5 mm. The meniscus is made of fibroelastic cartilage. It is a network of collagen, glycoprotein, proteoglycan, and cellular element, and about 70% water. After that, 3 ligaments are attached to the meniscus. The coronary ligament connects the meniscus peripheral. The transverse intermeniscal ligament is anterior and serves as the connection between the medial and lateral meniscus. The meniscofemoral ligament joins the meniscus to the posterior cruciate ligament (PCL) and has 2 components: the humerate ligament in the anterior and the wristbird ligament in the back. Lastly, the meniscofemoral ligament originates from the posterior horn of the lateral meniscus. The meniscus is supplied with blood from the medial inferior genicular artery and the lateral inferior genicular artery. The meniscus is known to have a very poor blood supply, especially the middle part, which gets most of its nutrient toward diffusion. The cartilage structure of the meniscus serves as a shock absorber and cushion of the knee joint. We continue with common injury at the joint. Injury may occur or without external forces applied to the knee. Usually, the pain is located along the line of the knee joint. Common complaints are painful and mechanical complaints such as clicking, catching, locking, or inability to extend the knee fully. For the mechanism of injury, the most common mechanism of meniscus injury is a twisting injury with the foot anchored on the ground, often by the body of another player. Slow rotating forces can also cause tearing. Meniscus tear are of the following type: longitudinally, radius, bucket holder, wing, horizontal cleavage, and degenerative. We move to the do and don't. For do the test with care. For don't, do not apply the wrong technique. Lastly, equipment required. For apply test, only a table is needed. The Leishman test, Dia test, Clade sign test, and McMurray test is no equipment needed. Procedure of apply test. First, to perform this test, place your patient in a prone position. Then, pair the tester leg with your own leg and bring the knee into 90-degree flexion. As you give the distraction, do a lateral rotation of the tibia and medial rotation. You are looking for excessive rotation over the other side or discomfort. Then, repeat the same procedure while you give the compression. In this case, you are looking for a decrease in rotation or discomfort. If the rotation plus restriction is more painful or show an increase in rotation than the normal part, the injury is most likely a ligament. If the compression plus rotation is more painful or show reduced rotation than the normal part, the lesion is more likely a meniscus damage.
Hi and Assalamualaikum. My name is Nurashkin binti Karudin. Today I'm going to present about knee special test for ACL, which is the Leishman test. So the Leishman test is done to check for an anterior cruciate ligament (ACL) injury or tear. So first one is anatomy of anterior cruciate ligament. Anterior cruciate ligament injury is the overstretching or tearing of the ACL in the knee. So bones are connected to other bones by ligament. So there are four primary ligaments in your knee, which is the first one is lateral collateral ligament, posterior cruciate ligament, anterior cruciate ligament, and medial collateral ligament. So they function as a strong ropes to holding the bones together and stabilizing your knee. So with the anterior cruciate ligament in front and the posterior cruciate ligament in the back, so they form a X shape. So your knee's back and forth mobility is controlled by the cruciate ligaments. So the anterior cruciate ligament runs diagonally in the middle of the knee. So it prevents the tibia from sliding out in front of the femur, as well as provide rotational stability to the knee. Okay, now we go to the common injury at the joint. So about half of all anterior cruciate ligament injuries occur in conjunction with injury to other knee structures, such as articular cartilage, meniscus, and other ligaments. So in this ACL, they have three grades. The first one is grade 1 sprain, is the ligament is mildly damaged. It has been slightly stretched, but it still be able to have the knee stable. So grade 2 sprain, a grade 2 sprain stretches the ligament to the point where it becomes too loose. So this is often referred to as a partial tear of the ligament. So grade 3 sprain is this type of sprain is mostly commonly referred to as a complete tear of the ligament. So the ligament has been split into two pieces. So and the knee joint is unstable. So partial tear of the anterior cruciate ligament are rare. So but mostly ACL injuries are complete or near complete tears. Mechanism of injury. So three major types of ACL injury are described. So the first one is direct contact, which is 30% of the case. Second is indirect contact, and lastly is non-contact. So non-contact is 70% of the cases. So by doing a wrong movement. So like changing direction rapidly, stopping suddenly, slowing down while running, landing from a jump incorrectly, and direct contact or collision, such as a football tackle. So ACL injuries are common in young individual who are participate in sport activities. The do and don't while doing this special test. So do with the right angle 20 to 30 degree of the knee. So don't do the test with the wrong angle of the knee. And do with the professional care, and don't pull a force while doing this test to avoid any further injuries.
To perform this test, have your patient in supine line position and bring your patient test leg into 30 degree of flexion. Fixate the femur with your other hand and bring the tibia into slight external rotation, and then try to translate the tibia anteriorly. This test is positive if you experience a soft or mushy and feel if the anterior translation of the tibia in the injured leg is at least 3 mm greater compared to the uninjured leg.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Asfar bin Khalid Rainan, and today we explain to you guys the anatomy of posterior cruciate ligament, or we call it PCL. So for the PCL, we use a dial test, and Next, I will explain to you guys what is a dye test, and now I will explain to you guys the anatomy first. For the posterior cruciate ligament is often injured from a blow to the front of the knee while the knee is bent. Okay, it's occur in motor vehicle crashes and sport-related contacts such as rugby, football, or hockey. The sport that have a high risk. Okay, and the posterior cruciate ligament tears tend to be partial tears with the potential to heal on their own. Okay, next slide is common injury. For the common injury, uh, the PCL will common uh, common in a motor vehicle crash, such as when a bent knee hits the dashboard in a car accident. So, as we know, in front is the most risk to hit the dashboard when when the knee is bent, and suddenly it will when the accident happen, it will hit the dashboard, and it makes uh, the posterior cruciate ligament tears. Okay, and next is sport related. So sometimes when they playing sports such as the sport that have a high risk, such as football or rugby or anything else that have a high risk when they are playing that sport. Okay, next is do and don'ts. For the do, we need to handle the patient with care, because the PCL is the sensitive part of our knee. So if we don't handle the patient with care, it will make the thing more worse. Okay, and for the don't is do not apply the wrong technique. Before we do this test, a dial test, we need to learn properly what we need to do in the dial test, because if we apply a wrong technique, maybe it can give it will give a risk to the patient or become a worse thing. Next, we go to the procedure. First, the clinician flex the patient knees to 30 degrees and place both hands on the feet of the patient, cupping his heel, and a maximal external rotation force is applied. Next, the knees need to be bent to 90 degrees, and again an external rotation force is applied. For the result is when there is a more than 10 degree of the external rotation in the injured knee compared to the uninjured knee.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Shazwan Akmal bin Ahmad Shukri. I am from RSR 2454B. Okay, today I'm gonna present about the patella tendonitis. Okay, for a patella tendonitis, we use a Clark's sign test. There is Clark's sign test is not a regular aspect of the knee exam, but is used to detect anterior knee discomfort when the patient history suggests that this is the most likely causes. Okay, for the anatomy of patella tendonitis, the hard-working tendon connecting your patella, there is kneecap and tibia. Your shin bone is relieved by wrapping this simple band that right below your knee. It is also provide just the right amount of support and stability to reduce any pain that may arise during physical activity, like running, jumping, and even walking. Put a great deal of energy on your two knees due to an unnatural alignment of all the moving elements. Okay, next we proceed to the common injury. Okay, for the common injury, for the first that you might only notice discomfort in your knee when you first start exercising or after a particularly hard workout. For the second, that the pain develops with the time and begins to interfere with your ability to play your sports. And the third one is discomfort eventually become with unbearable. Okay, next we proceed to the do's and don't when you do this test or applying this test to the patient. Okay, for the do's, for the first that you must do is comfortable when applying this test at the injury place, that will make the patient feel comfortable when you applying the test for them. Then proceed to the don't. Okay, for the don'ts, when you apply this test, there is you do not apply the wrong procedure when applying the test to the patient. Okay, next we proceed to the procedure of Clark's sign test. Okay, for the first one, there is the subject is lying supine with the knees extended. Okay, for the second one is the patient stands next to the involved sides and also place the web space of the thumb on the superior border of the patella. Okay, for the third one is the patient is asked to contract the quadricep muscle while the examiner applies downward and inferior pressure on the patella tendonitis. Okay, for the result, the pain with the movement of the patella or inability to complete the test is indicative of patellofemoral dysfunction and considered a positive test. I think that's all from me. Thank you. Assalamualaikum.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Ahmad bin Zainan. Today I will explain about knee special test for torn meniscus. That is McMurray test. First, anatomy of the meniscus. The meniscus is a rubbery, flexible piece of the cartilage that provides cushioning between the bones and knee. There are actually two meniscus in the knee. Each individual meniscus is formed to fit the area to the joint surrounding it. First is medial meniscus, which is located on the inside of the knee and the shape is C. And the next is lateral meniscus, located in outer side of knee and shape is U. Besides the meniscal function to reduce shock and absorb the amount of impact on the leg and knee when in motion or standing, to provide stability to the knee and to facilitate to smooth motion between the surface of the knee. As you can see in the picture, lateral meniscus and medial meniscus. Next is common injury. Sport related for this injury is when playing high risk sport such as rugby, football and basketball. When you have torn meniscus, you will have following signs and symptoms in your knee: popping sensation, swelling of stiffness, pain, especially when twisting or rotating your knee, difficulty straightening your knee fully, feeling as tough your knee is locked in place when you try to move it, feeling of your knee giving way. Okay, now is procedure of McMurray test medial meniscus. First, let your patient lie down in supine position. You standing on the same side as involved knee. Apply one hand on your patient knee. Next, other hand put on your patient ankle. Okay, external, rotate your patient knee to the outside and valgus press on their knee and ask him pain or not.
No pain.
Okay, that's all. Okay, next is procedure of McMurray test for lateral meniscus. First, let your patient lie down on the supine position. Therapy standing on the same side at the involved knee. Okay, apply one hand on the patient knee and the other hand on patient foot and ankle. Okay, internally, okay, rotate your patient knee and put a valgus stress on your patient and to the outside and ask pain or not.
No pain.
Alright, slowly rotate back. Thank you.